Welcome back for joining the podcast. Thank you for tuning in and listening to us and commenting on the sections and asking questions and stuff. We're having a good time. I'm Dr. Bell. It's Dr. Terrezza again. And we usually have other providers from our office as far as optometrists, but today we have our general manager, Kat, joining us. Kat, give us a little bit, how long have you been in the field and all that good stuff?
I've been in this field for about 15 years. I started out at front desk and worked my way as a tech, did optical dispensing, and then did a little bit of insurance and started managing practices. I've been with these guys for almost 10 years. It's been wonderful. I won't say like it's been, I mean, of course there's challenges with these two, but other than that, it's been great being on the team for sure.
Well, I will say this, and I think you would echo this. I've been doing this for a little over 20 years, and certainly there's things, insurance especially, progressives, things that I don't have the answer to that Kat certainly does. And I certainly appreciate her being on the team and answering the hard stuff that sometimes I don't know the answer to.
Well, and I like to tell people that I'm also a patient myself. I've been wearing glasses since I was 8, so like I understand the struggles. So I'm a big patient advocate for sure. So
there is no doubt in my mind that we wouldn't have grown as fast as we have without having her as general manager. I'm well aware of that. And that's why we'll continue to grow, probably double in size inside of 2 years.
And then also for the patients, that's a big part as well. We appreciate you, entrusting your eye care and your family to us. We've been in the area, Terrezza's been in the area almost 50 years next year. And that's a lot of patients we've seen and he's seen throughout the years. And we want to thank you patients for, entrusting yourselves, your family, your kids, for all your vision needs, your health care, your eye needs. Thank you for coming to see us. And that's what's helped us grow. Today's topic is aging eyes and insurance. We're going to kind of cover both of those. And I would like to say, certainly on some of our older podcasts, we've covered a bunch of these individual topics like age-related macular degeneration, cataracts, diabetic retinopathy, dry eyes, glaucoma, retinal detachments. Certainly these are things we always discuss with patients as far as when age, when the eyes get older, but we went into details on prior podcasts. So if you have any questions, certainly go back, look at those podcasts. We're going to go a little bit more specific in those, but today we'll just kind of talk in general about aging eyes and insurance.
Well, this segment of the population, the group that's over 55, is the fastest, largest growing segment in the whole demographic population line. And so the number of diseases are expected to at least double in almost every category. And thus the need for continuous monitoring and continuous treatment of these issues to keep the quality of life the way it should be becomes even more important.
Well, I will say this, certainly with us living longer in general advances in medicine, things that, cataracts, age-related macular degeneration, dry eyes especially, the longer you live, the older you get, sometimes the risk factors grow up with those things. They go up, meaning you have a higher chance of getting it. Certainly diabetic patients, the longer you're diabetic for, the more chance you may have retinopathy and issues and changes. And certainly those are reasons we encourage patients to get an annual eye exam, is so we can monitor the health of the eye along with the vision aspects.
It's a general rule with most diseases that the earlier you detect them, the better your outcome is. It's like putting out a small campfire with a garden hose as opposed to waiting till half the camp is up in flames and your car's burning and then decide to go in and get it fixed.
I was going to say, I know one of the things that we deal with, in clinic is we get a lot of patients that come in wanting their DMV form filled out. You'll get that green sheet from the DMV that says, hey, you've got to get your eye doctor to fill this form out. And, we do this for patients all the time. But in order for us to do it, you've got to come in and get an eye exam. Like, the doctor can't fill it out without seeing you, essentially. So we always recommend patients, when you get to the point of the age where they require you to get that reading or that vision test form filled out, we'll be happy to fill that out for you, but you've got to come in and get scheduled. And a lot of times they require you to come in every year, for the doctor to fill that form out. But again, you'd have to come in to fill that out.
Well, it's funny you say that. I will say this, as far as since I've been with Terrezza, I can think of 2 patients that came in just because they need their DMV form filled out, or maybe, hey, I've never worn glasses, but my vision has just gotten a little bit blurry within the last year or so. And those 2 cases were both young males that had major issues in the eyes. One had tumor, cysts, things going on that we wouldn't have seen if he never came in for that exam. So, certainly this is an extreme case, but vision, we always want to check and make sure you're seeing the best, but certainly there's a lot of other things we can pick up and detect inside the eyes that that we need to fix and make sure we can get that corrected as well.
Well, Florida is one of the few states too, if you're over the age of 80, you're going to need a vision certification to make sure you can still see well, regardless of your previous position or driving record or whatever other parameter you'd wish to measure. So after age 80, you come in, we fill out those forms for you, and hopefully keep you driving.
And we're always happy to do that as far as filling out any forms for driving, any work-related, forms that you have to get to kind of prove that you can see a certain thing. So, drop those off. Certainly a lot of patients will bring them the day of the exam, but even if you don't, you can bring them in after the fact, maybe leave them with us. The provider may not be there that day. It may take us a day or so to get it filled out, but we're happy to fill that out and get that back to you for both DMV purposes and other purposes. Flying. I can think of some that drive 18-wheelers. There's a lot of things out there that they have to, get things checked, get the vision checked for. So certainly we want to do that and make it as easy as we can. I think a lot of times maybe they're scared that they won't pass, but even if one eye doesn't see that well, and I have certainly patients that are amblyopic, or maybe one eye doesn't see, 28, but as long as the better seeing eye sees a certain vision, you're still going to pass. So I think a lot of times patients are scared and they still would pass, but let's get it filled out properly and get everything done for them.
There's another group of patients who think they see well because they've adjusted to their level of seeing. And this thing goes down so gradually that you're not aware of it, when in fact you're not seeing well at all, until you get hit with a major symptom or you get in an accident. You say, wow, I didn't see that guy coming. So rather than wait for that as the end point to trigger your new behavior of getting an eye exam, I suggest that you just do it on a regular basis, kind of like changing the oil on your car, whether you need it or not, every 5,000 miles.
Well, those are the patients, the ones that come in every year. I'm less concerned about those patients because we'll pick up things, if it is glaucoma, we'll usually pick that up in most cases. But the patients who only come in every 3 years, every 5 years, every 7 years, and we have some that do that, just come in when they have an issue or problem. In 3 or 5 years, a lot of things can change in the eyes. And those are the ones I'm most concerned about because, hey, maybe they had a high pressure for 3 years and it wasn't addressed. Or maybe they had bleeding, maybe they had a retinal tear detachment and they never came in. Well, a lot of times it's harder to treat it or get back that vision after the fact than it would have been if we'd have just seen it on the, proactively or seen it when it first happened.
Exactly.
I will add on to that, we get patients that are scared to come in to get their eyes checked because they feel like their driver's license will get revoked and things like that. But really, it's more of a safety thing. Like if you're having difficulty seeing road signs, that's like, here's your sign, you need to get your eyes checked. You have trouble seeing things up close or like things that, are in your car instrument and things like that. Definitely come in and get your eyes checked because, safety is always, the number one priority, obviously, when you're driving. There are different tips that we suggest to our patients that are seniors, Dr. Terrezza could probably elaborate a little more.
You're saying because I have experience in that regard? So
Personal experience.
My son indicated to me that I wasn't driving as well as I should have. And so anyway, I get a new car that he picked for me, and it had the iView by Subaru. I'm not suggesting you buy that individual car. I'm indicating to you that that thing was beeping every time I turned around because I was going too fast, going too slow, moved over in the other lane, made a turn without checking the lane, all kinds of things that I had become accustomed to. After about 6 to 8 months, those beeps died down pretty well 100%. and I'm driving a lot better. So I would suggest that as an alternative to getting your eyes checked, or in addition to getting your eyes checked, you might think about technology as a way to combat the ravages of age.
I will say, I know, especially just in the last couple of weeks, it seems the big one that I'm getting is glare issues. You know, patients are coming in, hey, those lights, those LED lights on those cars seem to be getting brighter. Maybe the street lights are getting a little bit worse. It's hard for me to see. I don't even drive at night anymore. I mean, these are things that we hear in the office. And certainly, even if you have a small prescription, when it's dark out, your pupils are larger, and sometimes it can make that prescription seem a little bit worse. So we certainly want to check the prescription. I have patients who only wear glasses when it's dim or dark outside. They don't wear them during the day because it shows up a little bit worse then. So let's look at the prescription. Maybe you need an anti-glare, anti-reflective coating on the lens. Maybe you have cataracts that's causing light to scatter, that's causing some of that glare. So certainly come in. I understand the lights are, you know, sometimes getting brighter, but also optically there's things that we can offer and do that will greatly reduce that glare and sometimes even eliminate it.
Another one that I run into is they'll watch TV and they'll have these glare lenses, and for $19.95 you get 10 pairs and they come with a full money back guarantee. And they come in and they said, "Doc, I tried all those, but now I came in to see you." And sure enough, they have an eye problem. And I'm indicating to you that a better strategy would get the eye exam first. And then if you want to fool around and buy everything you see on TV ads, then go ahead and do that.
Well, anything else? I was going to go ahead and move to insurance unless y'all got anything else on that. So I guess with insurance, we're going to dive into it a little bit more. Certainly we have a great billing department that works with us, that helps patients, you know, get things billed and gives us the information we need to help us out. But in general, we take, I would say 99% of most vision and medical plans that are out there. So I get questioned this a lot by patients. You know, you don't have to have vision insurance to come see us. If you have a medical insurance and you have a medical diagnosis that we can bill for your eyes, we can bill that to your medical insurance as well. So there's some patients who have medical insurance alone. There's some patients who have vision and medical. And if you don't have anything, we have self-pay as well. So certainly give us a call at one of our offices. You know, usually we can figure out, you know, insurance-wise what it's going to cost you, get you in there, get you scheduled. Certainly, Kat, go into insurance.
I was going to say, every office we have patient care coordinators, and that's literally what they do. They know your insurance. They may not know it right then on the phone when you make your appointment, but we have people that verify insurance, like verify your medical, verify your vision, verify your deductible, verify your copays, verify your benefits, and all that prior to you coming in for an eye exam. So you're not coming in surprised, like, oh, I didn't know this wasn't going to be covered, or I didn't know I had this copay, or I didn't know any of this stuff. We always tell patients, we'll go ahead and schedule you. Our insurance, you know, eligibility specialist people will verify all that prior to you coming in for the exam. And that's probably one of like the most important things, that when we make appointments, we always ask you for your insurance information ahead of time, because we want to have that information prepared and ready for you when you come in for your eye exam. And like Dr. Bell was saying, you know, a lot of people, they come in and they're like, well, I don't have any vision insurance. Well, do you have medical? Well, why do you need my medical? Well, keep in mind, the eye is an organ in your body. That is something that we can bill to your medical insurance if there is something medically going on with your eyes. It's not always vision related. So for us, you know, for patients, when we have vision related issues, we just immediately think, oh, it's vision. But I will say a good portion of the time, there is medical things going on that can cause your vision to deteriorate. And so it's important to give us all that information ahead of time, so that way we can coordinate all benefits. Just because we bill your medical insurance doesn't mean that, oh my gosh, I'm going to be stuck with this copay or this bill, because there's a lot of vision insurance that we can coordinate benefits with that can literally eliminate a lot of your copays and deductibles at the end of the exam. But however, if you don't have any insurance, we do see patients for self-pay. Our exams start at $99. Our glasses packages, you know, frame and lenses start at $89. And I know that's very competitive with a lot of online retailers. We get a lot of patients that are like, well, I don't have insurance, so I'm just going to buy my glasses online. Shop around. look at our package deals. We have package deals starting at $89, and I'm pretty sure we're pretty competitive with online retailers for that.
The other thing I want to make a point of is that other establishments in this area say that they take insurance. And what they mean by that is you have the insurance, you pay them, and they give you a bunch of forms, you go home and fill them out, and hopefully you'll get some of your money. That's not the way we do it here. We have 6 full-time insurance employees. We fill out all forms for every insurance and file it and then if there's any difference, we will bill you that difference or the deductible. But first, we get the money from the insurances, and then we bill you, not the other way around. So all that headache and all the details of filling those forms out correctly is taken off, and that's why we have 6 people on payroll.
And we try to be as transparent as possible. Certainly, we want to make this process easy for the patients, and that's the reason we have a billing department. That's the reason we go through this. And a lot of times on the front end, we'll say, hey, Ms. Jones, you do have a $20 copay. If it's going to go medical today, we want you to know before the exam even takes place, versus other places, that I've heard that on the back end, hey, you owe us $100 today. We want the patients to kind of know what to expect. That way there's no surprises throughout the exam, and that way they know, what the insurance covers and what their benefits are and all that stuff.
Exactly.
Yeah. Let's take a question. We've got one question here. How does my health care insurance work with my vision insurance? We talked about that a little bit.
I think I kind of already elaborated a little bit, but you'd be surprised. A lot of medical insurance we can coordinate with your vision insurance, so that way you wouldn't be paying as much in copays.
So we've got another question here as well, and we appreciate you sending questions to us for this. I have an aging parent that could benefit from using assistive devices to help with vision loss. However, this is a difficult subject to bring up. Any suggestions on the best way to discuss it with them so they don't feel I'm trying to take away from their independence?
I would say leave it open and talk in general. Say, look, there might be some things out there, and it depends on their age. You don't want to run them off by talking about computers and technological assistance when in fact they're not geared for that. If they are, so much the better. There's amazing new things out there for that. But if they're not, just leave it general and say, listen, let's see what options we have to help you with your vision and how we can do that. Let's go see the doctor and see what he has to say.
No, that's great advice. I know the one thing I try to do, every patient doesn't have to see 20/20 to be able to function and see do what they need to do day to day. And for patients that I see back, let's say for cataract evaluation, are they bad enough for cataract surgery? I will look at the cataract and evaluate it, but at the end of the day, what I talk to the patient and ask them is, hey, what are you doing throughout the day? And can you see well enough to perform those daily functions?
Exactly right.
And if they say yes to that, then that may be good enough. That may not be 20/20, it may be 20/40, but for what they're doing, they're able to see it and they're happy. But if they can't see that and it interferes with their daily activities, that's when we need to intervene and try to do something to get those patients to see better.
I agree. I don't think it's a clinic where we tell you what to do. Ours is a much more power sharing agreement where the patient gets to put his 2 cents or her 2 cents in and then make the final call. So even if I recommend, listen, I think your cataracts are terrible, you're going to need surgery, and they say, well, I don't want to do surgery. And I say, well, guess what? We won't do surgery. We'll get along the best we can without it.
Yeah, we can recommend all day long, but at the end of the day, what do you feel is best for you? Do you want to do this or you not want to do this? Well, we appreciate y'all listening in to our podcast. Thank you. Thanks for Kat for joining in today, our general manager. Keep the questions coming. Keep the comments. Like us on podcast. Any future topics you want to talk about, any questions, any family members with certain conditions, we'd love to hear from you and certainly talk about that in the future. Thank you, guys.
Thank you.